The Army Medical Department of the U.S. Army, known as the AMEDD, formerly named the Army Medical Service, AMS, comprises the Army's 6 medical special branches of officers and its enlisted medical soldiers. It was established as the Army Hospital in July 1775 to coordinate the medical care required by the Continental Army during the Revolutionary War. The AMEDD is led by the Surgeon General of the U.S. Army, a Lieutenant General. The AMEDD is the U.S. Army's healthcare organization, not a U.S. Army command. It is found in all 3 branches of the Army: the Active Army, the U.S. Army Reserve, and the Army National Guard. Its headquarters is at Fort Sam Houston, San Antonio, Texas, which hosts the AMEDD Center and School. Large numbers of AMEDD senior leaders can also be found in the Washington, D.C. area, divided between the Pentagon and the Walter Reed National Military Medical Center. The Academy of Health Sciences, within the AMEDD CNAMPS, provides training to the officers and enlisted service members of the AMEDD. As a result of BRAC 2005, enlisted medical training was transferred to the new Medical Education and Training Campus, consolidating the majority of military enlisted medical training in Fort Sam Houston. The current Surgeon General of the U.S. Army is LTG Nadia West. She is also Commander of the U.S. Army Medical Command. History. Both the AMEDD and the Army Medical Corps trace their origins back to July 27, 1775, when the Continental Congress established the Army Hospital, which was at the time overseen by the Director General and Chief Physician. Congress provided an Army medical organization only in times of war or emergency until 1818, at which point it created a permanent medical department. The Army Nurse Corps originated in 1901, the Dental Corps began in 1911, the Veterinary Corps in 1916, the Medical Service Corps emerged in 1917, and the Army Medical Specialist Corps came into existence in 1947. The Army Organization Act of 1950 renamed the Medical Department the Army Medical Service, and on June 4, 1968, the AMS was renamed the Army Medical Department. Heraldry. Coat of Arms. A regimental coat of arms was devised for the medical department, and was most likely first used in 1818. The 20 white stars on a blue background and the red and white stripes represent the U.S. flag of 1818. The green staff entwined with a green serpent combine 2 symbols: the rod of Asclepius from classical mythology, symbolic of medicine and healing, and the color green associated with the medical corps during the last half of the 19th century. The colors argent and gules are those associated with the flag of the United States. The rooster is associated with the ancient Greek and Roman god of healing and medicine, Aesculapius. The ancient Greeks believed that the rooster's crowing at dawn drove away the evil disease-spreading demons from the temple so that it could be a place of healing. The torso below the rooster shows alternating blue and silver colors, which were the colors of the Army in 1818. The Latin motto Experientia et Progressus is meant to convey the steady and unfailing progress of the Army Medical Department since 1775. Regimental Insignia. The design of the AMEDD Regimental Insignia is derived from the Regimental Coat of Arms. It is one of the U.S. Army's 14 Regimental Corps insignias. These insignias are worn over the right breast pocket on the Army service uniform and signify the service member's branch of service. The AMEDD insignia was approved on the 27th of October 2014. Branch insignia. See also, Rod of Asclepius and caduceus as a symbol of medicine in 1851. A caduceus embroidered in yellow silk on a half chevron of emerald green silk was first authorized and worn by hospital stewards of the medical department. The caduceus in its present form was approved in 1902. Today, the AMEDD branch corps insignia is a gold-color medal caduceus 1 inch in height, with the exception of the Medical Corps. Each corps is identified by a black enamel letter centered on the caduceus indicative of the specific branch. The insignia for Medical Service Corps is silver, rooted in classical mythology and associated with the Greek god Hermes. The U.S. Army's long-standing use of the caduceus has made it a well-known emblem of physicians and medical skill throughout the world. Medical Special Branches. There are currently 6 special officer branches in the AMEDD Medical Corps. The Medical Corps consists of commissioned medical officers who are physicians who have completed at least 1 year of postgraduate training or have been promoted from 01 to 03 following completion of medical school through U.S.UHS or the HPSP. The MC traces its origins to the 27th of July 1775, when the Continental Congress created a hospital, essentially a medical department and corps of physicians, for the Continental Army. Medical officers in the United States Army were authorized uniforms only in 1816 and were accorded military rank only in 1847. Congress made the designation of Medical Corps official in 1908, although the term had long been in use informally among the AMEDD's regular physicians. Today, members of the MC work around the world at all echelons of the Army. The chief of the MC is a major general, whereas the senior Army Medical Department officer is the Surgeon General. Military physicians serve in one of several general career fields. The 3 main fields are operational field, clinical field, and research field. Operational medicine is the field of Army medicine that provides medical support to the soldier and his per chain of command. Many operational physicians serve as division, brigade, and battalion level surgeons. These physicians are either assigned through the PROFIS system or through permanent assignment. Deployments with units to combat theaters are for the duration of a deployment, and the jobs are mostly filled by primary care physicians. A PROFIS provider can expect to be deployed away from the family for a total of 16 months. This means that primary care physicians are deployed for longer periods than most specialist physicians. A specialist are usually deployed for 6 months. Operational physicians should expect that more than 60% of the time will be spent in administrative roles and non-patient care. 40% of the operational provider's time is spent caring for soldiers or supervising unit physician assistants. With the recent brigade combat team restructuring, the demand for operational surgeons have increased. It is possible that the low retention rates of captains and junior major rank physicians in the primary care fields are due to the discrepancies in deployment length and deployment frequency between primary care and specialty physicians. Clinical medicine is the field of Army medicine in which a physician in uniform performs similar functions to a physician in the civilian arena. These physicians are assigned to a PROFIS unit in one of the various Army MEDCEN and MEDDAC. Primary care physicians usually deployed to fill battalion-level surgeon positions. Medical specialists deployed to support CSH. Research medicine is filled by a minority of military physicians. Most of these research physicians are based in larger Army medical centers and the research institutes. Nurse Corps. The Army Nurse Corps became a permanent corps of the medical department under the Army Reorganization Act passed by Congress on 2 February 1901. Its motto is "Embrace the past, engage the present, envision the future," and its mission statement declares, "All actions and tasks must lead and work toward promoting the wellness of warriors and the families, supporting the delivery of warrior and family health care, and all those entrusted to our care, and ultimately, positioning the Army Nurse Corps as a force multiplier for the future of military medicine." Dental Corps. The Dental Corps consists of commissioned officers holding the Doctor of Dental Surgery degree, a Doctor of Dental Medicine degree. The Chief of the Dental Corps is a Major General. Enlisted soldiers may be assigned as dental assistants, although the collar insignia lacks the D and is the same as that worn by medics. Army Dental Corps officers may train further in the following advanced training programs after dental school: advanced education in general dentistry, comprehensive dentistry, endodontics, oral and maxillofacial surgery, orthodontics and dentofacial orthopedics, pediatric dentistry, periodontics, prosthodontics, public health dentistry, oral pathology. The U.S. Army currently offers fellowship training in the following areas for Dental Corps officers: oral facial pain, maxillofacial prosthodontics, healthcare administration, dental informatics. The following 8 recognized specialties are not represented in the U.S. Army Dental Corps: oral and maxillofacial radiology. The Chief of the Army Dental Corps is Major General Thomas R. Rob Temple, Jr. His father, Major General Thomas R. Temple, Sr., served as Chief of the Army Dental Corps from 1990 to 1994. Veterinary Corps. The U.S. Army Veterinary Corps was established by an act of Congress on 3 June 1916. Recognition of the need for veterinary expertise had been evolving since 1776, when General Washington directed that a regiment of horse with a farrier be raised. It has evolved to include sanitary food inspectors and animal health care specialists. The Veterinary Corps consists of commissioned doctors of veterinary medicine, warrant officers of the Corps of its Food Inspection Service. Enlisted personnel can serve as food inspection specialists and veterinary technicians. Enlisted personnel's collar insignia lacks the V and is the same as that worn by medics. The Chief of the Veterinary Corps is Brigadier General Eric H. Torring. 3. Medical Service Corps. The Medical Service Corps consists of commissioned and warrant officers. Members are required to hold at least a bachelor's degree before receiving a commission. The MSC has the greatest range of duties performed by personnel. These may include administrative and support duties such as health care administrators, health services officers in operational units, healthcare controllers, healthcare informatics officers, patient administrators, health service human resource managers, health physicists, toxicologists, sanitary engineers, medical operations and plans officers, medical logisticians, health services maintenance technicians, and medical evacuation pilots. MSc officers serve in clinical support roles as clinical laboratory science officers, environmental science officers, pharmacists and preventive medicine officers. Medical Service Corps officers serve as commanders of field medical units in garrison and combat environments, and provide health care to patients as psychologists, social workers, optometrists, pharmacists, podiatrists, and audiologists. The Medical Service Corps also functions as a transitional branch encompassing commissioned medical, dental, and veterinary students who have not completed the training through the Uniformed Services University of the Health Sciences of the Health Professions Scholarship Program. Medical Service Corps officers are drawn from the various Army commissioning sources following a branch immaterial curriculum. Since a primary function of the Medical Service Corps is to manage combat health support activities, its officers hold general command authority and can compete for company and field grade command of medical support formations and detachments, as well as logistics and aviation commands along with officers of the Army competitive category branches. In contrast, Medical Corps, Veterinary Corps and Dental Corps officers are limited to command billets specific to the respective corps. The Chief of the Medical Service Corps is Major General Patrick D. Sergeant. Medical Specialist Corps. The Army Medical Specialist Corps consists of commissioned officers. Members hold professional degrees and serve as clinical dietitians, physical therapists, occupational therapists, and physician assistants. Members of the SP serve all around the world and at all echelons of the Army. The Chief of the SP Corps is Colonel Nicky Butler. Enlisted Medical Career Management Fields. There are currently 24 military occupational specialties for enlisted medical soldiers, 68A biomedical equipment specialist, 68B orthopedic specialist, 68C practical nursing specialist, 68D operating room specialist, 68E dental specialist, 68F physical therapy specialist, 68G patient administration specialist, 68H optical laboratory specialist, 68J medical logistics specialist, 68K medical laboratory specialist, 68L occupational therapy specialist, 68M nutrition care specialist, 68N cardiovascular specialist, 68P radiology specialist, 68Q pharmacy specialist, 68R veterinary food inspection specialist, 68S preventive medicine specialist, 68T animal care specialist, 68U ear, nose, and throat specialist, 68 volts respiratory specialist, 68W healthcare specialist, 68X behavioral health specialist, 68YI specialist, 68Z chief medical NCO. In addition, outside the AMEDD is the Special Forces Medical Sergeant. Museum badges.